with the COVID deaths in the Commonwealth. There's been 15,000 since the start of the pandemic.
And now as we head into the winter months, health leaders are urging caution. Tonight on your side at 6, Karina Bolster joining us live outside of VDH headquarters with the very latest. Fill us in, Karina.
Well, Kurt and Makia, it's certainly a staggering number, but state health leaders continue to urge folks to talk about prevention measures as this pandemic throws more curveballs at us.
The best thing we can do to really slow that down is to just make sure we get as many people vaccinated as possible.
Roughly 66% of Virginians are fully vaccinated at this point, but it's been a work in progress.
Everybody loved him. They did. They always would tell me, your dad's so great.
Deborah Vituro lost her father, Robert Accomando, in April of last year to COVID-19. Robert was one of 5,000 Virginians who died in 2020 before a vaccine was made available. 2021 was not kind either. Since January 1st, more than 10,000 Virginians have died from COVID-19.
It's important that we all remember that every one of those numbers, they're not a number on a dashboard. That is someone's mother, father, uncle, sister, brother.
Perhaps someone who was the smiling face behind the wheel of a GRTC bus, like John Thrower or Civi Robertson, a 51-year-old Hopewell nurse who spent the last months of her life caring for COVID-19 patients before contracting the coronavirus herself.
I will miss her. We will always love her.
However, Virginia has fared better than surrounding states, according to CDC data. Pennsylvania has seen nearly 35,000 deaths, New Jersey nearly 29,000, West Virginia on the low end with 5,000 deaths. But here in Virginia, VDH acknowledges there are breakthrough cases among fully vaccinated Virginians. Of those vaccinated, 0.02% have died. That low percentage, another reason why health leaders continue to push for vaccinations.
So we don't have to keep seeing these deaths. I think we'd all want to keep our loved ones around for as long as we can.
Now, as for double the number of deaths this year compared to last, VDH says there are a number of possible factors which could have led to the increase, including the fact that vaccines were not widely available to Virginians until the late spring. Now, 2021 also saw the introduction of several new variants, including the Delta, which studies have shown it can be more severe than some of the other strains. Live and on your side in Richmond, Karina Bolster, NBC 12 News.